Doctor, you first here. How concerning is it to you that we now have a second state removing fluoride from its water supply?
Well, Alex, I think this is indicating and signaling what's happening across the country, which is a bent knee approach across some states to public health policies that frankly have no evidence or grounding in reality. And so, we know that fluoride in the water supply helps prevent cavities and that it is kept within very safe limits because it's constantly being monitored. And so we know that 0.7 milligrams per deciliter, for example, or per liter is the safe level. And there are not unsafe levels of fluoride in the Floridian water supply. And that's what the purpose of the EPA and the U.S. Public Health Service is, to monitor that. But as the EPA continues to get defunded, will they be able to do that work moving forward? We'll see. But there is no issue here. This is complete smoke and mirrors.
Let me pick up on that with you, Doctor, because we have the Tallahassee Democrat reporting that Governor Ron DeSantis called fluoride forced medication. He did so at the bill signing yesterday. I mean, how dangerous is a statement like that? You heard what Jesse said about how it really evens the playing field and gives everybody a chance, certainly kids on up, at having healthy teeth. What do you recommend people do after July 1st?
Well, this is complicated in the sense that this is really frustrating. And what they're trying to do is they're cherry picking data and misinforming people. This is their playbook. Let's just take a random data point here that is not relevant, is not causing a problem, and then scare people. This policy in Florida, the second state, is a solution in search of a problem that does not exist, to be clear. Jesse's exactly correct. Fluoride in the water supply is safe. It promotes it de-risks the risk of school absenteeism because of dental problems, and exactly that. For those that, for example, can't afford access to a dentist because the supply of dentists is not great. Not everybody has regular access to that. This is an equalizer. We know that safe levels of fluoride exist throughout Florida. It's not an issue. It's never been an issue. And it prevents tooth decay. That's the whole point here, especially amongst kids. And so, again, this is a solution in search of a problem that does not exist.
And this comes a couple of days after HHS Secretary Robert F. Kennedy Jr. testified before Congress about vaccines. Let's take a listen to that.
If you had a child today, would you vaccinate that child for measles?
For measles, probably for measles. What I would say is my opinions about vaccines are irrelevant. I don't think people should be taking medical advice from me.
I'm sorry, he's the head of HHS. So if not him, who?
That's a good question. Let's broaden out from just him. He's surrounded himself with doctors who are doctors in name only. They aren't doctors like myself and my colleagues that actually care for patients. His Surgeon General pick doesn't have an active medical license, never actually completed residency. Dr. Oz has spent most of his time now in the wellness space, far removed from clinical care. His head of NIH is not a clinician. Marty Makary gave up clinical practice a while ago. I mean, there's a phenotype of a quote unquote doctor that is surrounding Robert F. Kennedy Jr. that is not credible. They are not credible or respected in the clinical community. So, of course, he's going to make these comments and they're not going to push back.
You're speaking to the daughter of a thoracic surgeon, and I'm proud to have been that. And I know how important the medical community is and the scientific knowledge. And yeah, okay, sobering. Thank you, Dr. Ben Gubin.